Hello again. If you've viewed me for any period of time, I've said countless times that Obama's destroyed the middle class. One of my friends sent me a rather interesting article. It's lengthy. I hope you take the time to listen to it. It starts off, I'm a 54-year-old consulting engineer that makes between $60,000 and $125,000 per year, depending on how hard I work and whether or not there are work projects out there for me. My girlfriend is 61 and makes about $18,000 per year, working as a part-time mail clerk. For me, making $60,000 a year under Obamacare, the cheapest, lowest grade policy I can buy, which also happens to impose a $5,000 deductible, costs $482 per month. For my girlfriend, the same exact policy, same deductible, costs $1 per month. That's right, $1 per month. I'm not making this up. Don't believe me? Just go to coverdoc.com.gov, the Obamacare website for California, and enter the parameters I've mentioned above and see for yourself. By the way, the zip code is 93940. You'll need to enter that. So, okay, clearly Obamacare is a scheme that involves putting the cost burden of health care onto the middle and upper income wage earners. But there's a lot more to it. Stick with me. And before I make my next points, I'd like you to think about something. I live in Monterey County in Central California. We have a large landmass, but just 426,000 residents, about the population of Colorado Springs or the city of Omaha. But we do have a large Hispanic population, including a large number of illegal aliens, and to serve this group, we have Nativity Medical Center, a massive federally subsidized county medical complex that takes up an area about 1/3 the size of the Chrysler Corporation automobile assembly plant in Belleville, Illinois. See Google Earth view. Natividad has a state-of-the-art operating rooms, computerized tomography and magnetic resonance imaging, fully equipped 24-hour emergency room, and much more. If you have no insurance, if you've been in a drive-by shooting or overdosed on crack cocaine, this is where you go, and it's essentially free, because almost everyone who ends up in the ER is uninsured. Last year, 2,735 babies were born in Natividad. 32% of these were born to out-of-wedlock teenage mothers, 93% of which were Hispanic. Less than 20% could demonstrate proof of citizenship, and 71% listed their native language as Spanish. Of these 876 births, only 40 were covered under any kind of private health care insurance. The taxpayer paid for the other 836. And in case you're wondering about the entire population, all 2,735 births, less than 24% involved insured coverage or even partial payment on behalf of the patient to the hospital in exchange for services. Keep in mind as we move forward. Now consider this. If I want to upgrade my policy to a low deductible premium policy, such as what I had with my last employer, my cost is $886 per month. But my girlfriend can upgrade her policy to the very same level for just $4 a month. That's right, $4 a month. $48 per year for a zero deductible premium healthcare policy, the kind of thing you get when you work at IBM. Except, of course, IBM employees pay an average of $170 per month out of pocket for their coverage. I mean, it's bad enough that I will be forced to subsidize the Obamacare scheme in the first place. But even if I agreed with the basic scheme, which of course I do not, I would never agree to subsidize premium policies. If I have to pay $482 a month for a budget policy, I sure as hell do not want the guy I'm subsidizing to get a better policy for less than 1% of what I have to work for each month for a low-end policy. Why must I pay $482 per month for something the other guy gets for $1? And why should the other guy get to buy an $886 policy for $4 a month? Think about this. I have to pay $10,632 a year for the same thing that the other guy can get for $48. $10,000 of net income in 60 days of full-time work as an engineer. $48 is something I could pay for collecting aluminum cans and plastic bottles one day a month. Are you with me on this? Are you starting to get the idea that Obamacare and what it's really all about? Obamacare is not about dealing with inequities in the healthcare system. That's just a cover story. The real story is that it is a massive political power grab. Do you think anyone who can insure himself with a premium policy for $4 a month will vote for anyone but the political party that provides him such a deal? Obamacare is about enabling, subsidizing, and expanding the left's political power base at taxpayers' expense. Why would I vote for anyone but a Democrat if I can have babies for $4 a month? For that matter, why would I go to college or strive for a better job or income if it means I have to pay real money for health care coverage? Heck, why study engineering when I can be a schlub for $20,000 per year and buy a new F-150 with all the money I'm saving? And think about all those $4 a month babies. Think in terms of propagation models. Think of just how many babies will be born to irresponsible, undereducated mothers. Will we get a new crop of brain surgeons and practice psychiatrics for the Dollar Baby Club? Or will we need more cops, criminal courts, and prisons? One thing you can be certain of, a $4 a month, you multiply and multiply and multiply. Hey, how do you argue with that? Everything that this administration is doing is to completely destroy the Republican Party. And the Republicans' leadership is helping them. You will never see a Republican in control of anything based on what Obamacare is designed to do, based on what Obama's immigration plan is designed to do, based on what Obama is designed to do. You think not? Well, you weren't listening to what I just read you.